Hello, my name's Stacy. I'm going to be your nurse practitioner here at the other clinic. I'll give you kind of a minute to see if your volume is adjusted well so you can understand what I'm saying and hear me okay. All right, everybody got it? Okay, good. So I'm going to go over a little bit of the effects of masculinizing therapy, which is pretty much testosterone therapy. I'm going to be glancing at papers every now and then because I am old and I kind of need some help to keep me on track sometimes because I tend to ramble. Anyways, I'll be going over the effects, meaning side effects, the physical effects that'll happen and changes that happen while you're on testosterone therapy. So, buckle in, here we go. So, first thing to start off with is this is going to be like a second puberty. What that means is you remember your first puberty lasted for at least a couple of years. Average puberty time is about 2 to 5 years long. So this isn't a race. You know, you're not going to get on testosterone and then be uber masculine in 1 year. You know, don't expect those kind of results. Usually what we find is that the longer, more natural puberty time that it takes, the better results you're going to have overall. And it kind of gives you time to adjust and kind of get used to the things going on, and probably a little bit lower side effects as well. The longer and steadier path that it takes. So, anyways, let's move on. So, one of the first changes you might see could be potentially your voice. It's going to deepen. This is one of the permanent changes that testosterone will render. You'll notice within probably the first 3 to 6 months, you're going to get a little bit of deepening of the voice. You might even get a little bit of that Adam apple going on right there on the throat. So be sure if you want to make a recording of a before so you can hear it whenever your voice has changed and see how far you've come. It's pretty interesting. Another change you might see would be in regards to hair on your head and all over your body. Most of it's going to thicken on your body and kind of sprout out a few more where you might not have had any before. In regards to facial hair, that's usually going to be what takes one of the longer times to change, anywhere from a year to 5 years to really get good facial hair growth. At some point during your transition, you might want to start using some Rogaine on your face, as that can kind of help move things along and bring in more and thicker hairs. We can discuss that more in your appointment if you'd like. Another thing that may happen in regards to like your fat levels, your muscles and everything, you're going to have more muscle mass. In general, a cisgender man is going to have about 30% more muscle mass on average than your typical cisgender woman. So when you're on testosterone therapy, your muscle mass will start increasing. You can certainly help this along by doing, strength and conditioning exercises and normal cardiovascular exercises, walking, jogging, biking, things like that. Your fat on your body is going to redistribute into a more male pattern, and that's going to involve, say, whereas females have their hips and their butt and their thighs, they have that hourglass shape, that's going to thin out down there. It may redistribute more to like the abdomen or the chest and shoulder region. Your face may become a little more rugged or angular looking. That's also from fat shifting and redistributing in your face. It's not from actual like bone changes or anything like that. And then in regards to your breasts, those are likely going to stay the same. I mean, those are just going to be with you until you either get surgery or if you want to just kind of bind them. So that's up to you, completely up to you. Another thing to notice is with your skin. Your skin is probably going to get a lot thicker on testosterone. Some people have mentioned to me that it makes things kind of feel different to them. I mean, I suppose it makes sense. If you have thicker skin, you could have either decreased sensation with some things. A lot of people find they have decreased sensation to cold, and it's probably partly due to this. And also partly due to increased red blood cell count, which we'll get to in a little bit. And let's see, in regards to, say, emotions and personality. So there's a myth out there that whenever you get on hormones that it's going to change you and you're going to be a different person. That is completely not true. You may become a little more interested in some things, or you may be more outgoing because it kind of relieves some of the dysphoria that you may have been having. But anyway, you will not change your basic personality. That's a myth. But you should know that just as in regular puberty, it can give you mood swings, things like that. So if you find that you're really like extra aggravated with people, you might want to check yourself and just be like, okay, is this the hormones or are they really that aggravating? Let's see. Another thing it may increase in regards to emotions / personality is sex drive. In general, testosterone is going to increase your sex drive a lot. So just kind of be aware of that. I mean, everybody always giggles and talks about how, watch out, keep an eye on your daughters because those teenage boys are crazy. Well, I mean, to an extent, they're not wrong because that raging hormone testosterone that's in their body will give them that sex drive and everything. And they're so young and inexperienced, they literally have no idea what to do with it. But you will, because one, you're forewarned, and two, you're older than a teenage boy, so you will have experience coming into this puberty for yourself to kind of grow with. Let's see. Next, in regards to sex. So some people think that it feels different. Usually the sex drive is increased. Some people find that they're more interested in maybe different positions or different toys or things like that. This is kind of a time where you can explore what you like, find out if you're comfortable doing things or whatever, discuss it with your partner for sure. Just be very open to exploring and learning during this time because it will change you to some extent there. And in regards to that, let's get to the genital changes it can cause to occur. You will almost definitely get some clitoral enlargement. That's just almost one of the first things that happens actually. And I mean, that sucker can get pretty big. Now, most people find that as a benefit, honestly, especially during sexual activities. And if you plan on having surgery later, it can actually be very beneficial to have grown a pretty large one because it gives more tissue to work with for the certain surgical procedures that they perform for bottom surgery. Let's see, what else? Over here, in regards to fertility, a very important thing that we need to talk about would be fertility concerns, because right now the going theory is that this will make you infertile. There is a very good chance that it could, or at least that's what the current research seems to say, although what people are going off of, the current research is actually fairly old in terms of research. So there have been new studies that have said, if you come off of testosterone therapy for, 6 to 8 months, then say you might resume your menstrual cycle and, release eggs again and be able to become pregnant. So this is something to be aware of. It's also a reason why you should, if you have sexual intercourse with someone that produces sperm, even though you're on testosterone therapy and your menstrual cycle might have stopped, there's still a slim chance of pregnancy. And if that's not something you're interested in at the time, then you need to be using some kind of protection, which can involve birth control pills or condoms or whatever, makes you comfortable. But it's something to be aware of, that it still can happen while you're on testosterone. And testosterone is not good to be on if you become pregnant. It can actually harm the fetus. So if for some reason you discover that you are pregnant on testosterone, you need to stop taking it and contact me immediately. We will get you in touch with an OBGYN so you can discuss your options there. In regards to whether or not you should start hormone therapy before you have children, that's something that you'll have to decide on your own. It's a very personal decision. If you really are dead set on having your own biological children later in life, I really do recommend that you look into getting eggs frozen. I know for a lot of people that is kind of cost prohibitive because it can run anywhere from $3,000 to $5,000 in the area that I'm in anyway. I mean, other areas of the country are probably different, but around here, Mississippi, somewhere around like $3,000 to $5,000, and it's a process that takes several weeks. So it's something that you really need to know if you want to do. Like I said, it's not the end of the world. It seems anyway, if you decide to go ahead and go on T therapy and then later come off of it and try to conceive, there is just that chance, though, that you should be aware of, that you could be rendered permanently infertile by it, and therefore you would need to either then adopt, or perhaps your partner would need to be the one who actually carries the child, or other options as it may apply to your situation. Anyways, so, and also, I should mention, your menstrual cycles should stop almost completely whenever you get onto a testosterone dose that's physiologically male in range, but you may still have some breakthrough bleeding, like some spotting or something here and there. That's typically not an issue, but if you've had no menstrual cycle for months and months, and you've been consistently taking your medications, and then all of a sudden you have a full-blown period, that's something to definitely let me know about, because we may need to check your hormone levels sooner than the next time that you're going to have labs, just to make sure that nothing's going on. And let's see, next off, so when I mentioned earlier about how you'll get thicker skin and maybe, you'll have altered sensation and especially not be as susceptible to cold. One of the other reasons you might not be so susceptible to cold is because it increases your blood count. So folks with testosterone, typically cisgender males or trans males, will produce more blood cells on average than females. So we'll keep an eye on your blood count, because if it gets too high, that can be a problem. It puts you a little higher risk for blood clots and whatnot. It's not a huge deal if it does. If we check your blood and it's a little bit high, we may just tell you you can either decrease your testosterone dose, or you can just go donate blood every now and again, and that effectively will solve that problem. So it's not that big a deal. But having those higher blood levels means you stay warmer easier, so you may not be as affected by cold. Kind of a benefit, I guess. Let's see. There are some studies out there, mostly are older studies, but they indicate an increased cardiovascular risk for folks on testosterone. A lot of those studies are based on cisgender males who are on it for hypogonadism. So the jury's kind of out on whether or not this is an actual increased risk for those who are transgender, who are transitioning male, and on testosterone. So it is something to be aware of, that it can put you at higher risk for like high blood pressure, stroke, heart attack. But until they really get some better quality and more lengthy studies out there on actual trans people, we won't really know the answer to that risk number. How high of a risk do you really have? They don't really know. They just know that we probably should tell you that you are at an increased risk. We just don't know how much. It could be 0.03%. It could be 4%. They just don't know. But if you have any further questions about that and your potential risks, certainly feel free to ask me during the appointment. Depending on your age, your concurrent medical conditions, like if you're diabetic or something like that, it could put you at potentially a slightly higher risk. So, I mean, that is something to be aware of again. And like I said, if you have any questions during the appointment, just ask me. Let's see, what else do I need to go over with y'all? Looks like pretty much covered most of it. Now, another couple of little high points I guess I should hit is back to the hair part. So in regards to hair, a lot of times you'll see a more male hair pattern developing, which means you'll see like up here, my hairline goes here. If I were to transition male, then probably I would lose a little triangle of hair out here, because it would just kind of recede a little bit. That's not to say that it's going to recede back and then you're going to have like no hair at all. That's just the typical or more typical male hair pattern. I mean, it may not happen at all, but it is worth mentioning to you in case you look and you're like, oh my God, my hair's kind of, what's going on? You know, that's a thing that does happen. Now, if you have it in your family where, you know, you have balding men in your family, there's a good chance that you might get that as well, and it's something to watch out for. And if you start noticing that it's happening to you, you might want to get some Rogaine and start kind of pre-treating back there to help prevent any further loss and hopefully get some regrowth or something back there, whatever you can help prevent, because I know that's a big issue of why people don't want to get on testosterone therapy sometimes, is they're afraid their hair will fall out. There are measures we can take to help prevent or mitigate that. So like I said, just ask me during the appointment, and we can discuss that if that's a large concern of yours. Let's see, anything else that I'm leaving out? Oh, just kind of an interesting thing that some patients have told me in regards to the emotions thing. I've had folks who transitioned and said that, you know, they used to cry during particular, like, I don't know, like Hallmark movies or Lifetime television for women, you know, those kind of movies where they're made to make you cry. And they say that later on, after they've been on T therapy for a while, they find that they don't cry as easily at things that they used to cry at. And that's not to say that they're like emotionally constipated or anything like that, but they kind of find that their emotions are experienced differently. Like they say they're still sad during the movie, but they don't feel the urge to like just tear up and bawl their eyes out or anything like that. That's not to say everyone feels that way, but some of my patients have told me that that they kind of feel that, like the more feminine emotions are blunted, I suppose you'd put it. But anyway, so if you have any other questions regarding effects of testosterone therapy, write them down, bring them up during our appointment. Certainly this is not an exhaustive list of what goes on and what happens during testosterone therapy. Everyone is different. Everyone metabolizes the medicine different. Everyone experiences growth and change differently. So you may experience something that someone else did not. Just feel free to bring it up, and I can tell you, you know, whether or not I'm experienced with that, you know, if it's a normal thing or if it's something I haven't heard of or something that we need to look at or be worried about. And then even after you've had the appointment, if something happens, you can always text me, whatever, just, you know, I'm fine with that. I want you to have a smooth and safe transition. I want you to feel like you're very supported here with this clinic. So any problems, any questions, anything, just give me a text, email, call, whatever, you know, and I'll, if I'm not available immediately, you know, if I'm seeing a patient, I will get back with you. That's absolutely no issue at all. And anyway, so I guess it'll be goodbye for now, and I can't wait to meet you.